Thank you so much, Bonsai Betty D. All right, ladies, listen up. We are helping in the battle against cellulite. Let's welcome in Dr. Shim Ching. He is from the Queens Medical Center. And doctor, I ask, we saw and we've been seeing all these commercials about Wicked, and we have witches with wands. It appears you've brought a wand. What do you have with you right here?
Well, this is the actual instrument that we use to deliver the laser energy for the cellulite laser surgery that we've been doing.
So this is the actual, this is what's delivering, if you will, the laser?
Yeah, it's a little bit more complicated when we set everything up, but essentially this is what goes into the patient. So it's quite small, only about 3 millimeters in diameter, and we make a small incision, and that's really all you really need to do this sort of surgery.
Now, cellulite is predominantly a woman problem? I mean, it's mostly found with ladies?
Pretty much is predominantly women. There are very few men that can have it. We believe that it's related to the female hormones and how they influence the skin.
Okay, well, now we saw earlier what cellulite exactly was. Now, this, help me understand what we're seeing here. Well,
this is the wand that I just showed you going into the skin. And the wand is doing three things. The laser is doing three things. It's smoothing out the pockets of fat that cause the bulging. It's releasing those little attachments that cause the dimpling. And then the third step is to go in and thicken and tighten the skin to make the skin nice and smooth, just like everybody would like their skin to be.
Yeah, certainly. How long does a procedure take? Does it depend on how much you're working on?
Yeah, pretty much. It depends on how much we need to do, but typically it's less than an hour.
Now, what kind of recovery time is it for women who have this?
Because the incisions are so small and we're using a laser, the recovery is very, very short. I've had a lot of women go back to work the next day after doing something like this.
Is it like liposuction, or is that not an accurate?
I
mean, we've heard a lot about that, and it's certainly gained traction and attention over the past decade or so. But
definitely, it's similar in that the incisions are small, and we're putting a small instrument in the body, but we're not actually sucking out any fat like we do with liposuction.
Is there a way folks could get in touch with you if they wanted to inquire about this? And is this, how's the way I handle this? Is this a cosmetic procedure? I mean, when it comes to insurance, it's not necessarily covered, right?
Yeah, this is completely cosmetic. And if they want to reach us, they can look up my practice on the internet. And
I was going to say, there's a Queens referral line as well that would probably direct you towards you.
Definitely.
Thank you, Dr. Ching. Appreciate it very much. We'll make sure and put that online at kh12.com. Thank you, sir.
Much.
All right, still to come on Wake Up today, we have got top headlines quickly approaching. But now let's send it on over to Jai, who's got an interesting interview. Jai, what's going on? Yeah, I think ladies might find this very interesting. You may want to listen up there, ladies. Cellulite, can it be treated? Well, we welcome in Dr. Shim Ching from the Queens Medical Center here as Ask a Specialist on this Monday morning. Good morning to you, Doctor. First off, cellulite, help me define what that is exactly.
Well, cellulite is it's a normal condition of the skin. And it's estimated anywhere between 80 to 90% of women have some degree of cellulite, so it's very, very common. It has to do with the structure of the skin. There are certain areas of the body that are very prone to cellulite, like the thighs, the buttocks, sometimes even the arms and the breasts, the abdomen. And what happens is that the skin has a dimpled and wrinkly appearance. Some people call it a cottage cheese kind of appearance.
Is it fat, for lack of a better word?
It's a combination of different things. It's fat that is bulging out. There's some retraction in the skin, a little bit of dimpling. And the skin is usually looser and thinner than other areas. And all three of those things contribute to cause cellulite.
How can it be treated? Because I think that's I don't know if the ladies would agree with me, billion-dollar question, million-dollar question, that's for sure. I mean, that's something they would definitely
billion-dollar question, because there's so many different things that women have used in the past to treat it. And
everything from like topical creams to massage to all kinds of things, right?
Exactly, and none of the things have really been all that effective. But recently we have this new laser device. It's called Cellulaze, and it's really the first treatment that we have that can actually address the structural problem, the actual root of the problem of cellulite. and it's revolutionary. It's something that's very exciting.
Now, what are we looking at here? Because this is kind of helps define what the cellulite is, correct?
Yeah. So we have this is a diagram of the skin, and you can see a little bulge where there's fat that's sort of protruding, and that causes sort of the bumpiness of the skin when it has cellulite. And there's little bands of tissue that retract the skin and cause the dimpling.
Oh, okay.
And you can also see in the diagram that the skin is thinner and looser, and those are the three things that we talked about.
Okay, Dr. Ching, if you don't mind, we actually have a little bit of a prop here, and we're going to show folks in the next break, or the next time we get a chance to talk to you here on Ask a Specialist, we'll get a chance to talk about, what was the surgery again?
It's called Cellulaze.
Cellulaze. We'll talk about that process, and we'll also help folks understand what kind of effects that might have on it.
Great.
Dr. Ching?
Yeah.
Thank you very much.
Thank you.
We appreciate it. All right, still to come on Wake Up today, we talked about that sleep study and what a sleep expert has to say. We're going to find